Good morning to the both of you. We're coming to you live off of Burton Street here at Advanced Oral Surgery. Let me show you your way right in. Things are going to be a little bit different. Instead of a nice waiting room, as we all remember, this is no longer accessible to patrons who are signing up here at Advanced Oral Surgery. You actually now have to start via text message, which is easy. You can actually hang out in the comfort of your own car, and then as soon as you're ready, you'll walk right on through. That's as quick as the waiting room is going to be. Joining us this morning is Dr. Mark Jessen and Dr. A.J. Lytle. Dr. Mark Jessen, a very, very profound professional here in the art of surgery when it comes to individuals who are suffering long-term oral care. Can you kind of tell us the backlog that you've experienced since you've been closed since February?
Yeah, it's just tremendous. We've had a lot of patients who've just been canceled, 2.5 months of patients, and patients can't wait with their oral care delayed. There's many immunocompromised patients who have diabetes or who have had transplants, and if they have infection in their mouth, that can spread throughout their body, and they can become really sick. We've seen some of the worst infections. We've been open treating emergencies only throughout this time, but now we're open to full care. So there's been a real access to care problem in Michigan and across the states, and it's incredible that patients now can actually pick up a phone and know that they can get the care that they need coming to a dental office and be safe at it.
Most definitely. So obviously we're looking at a different get-up here. People are going to be expecting and experiencing maybe some different procedures. Can you kind of walk us through those?
Yeah, so I know you alluded to already that the lack of the waiting room. The main thing is that we want social distancing. We want patients to get the treatment they need, but not be exposed to other people. And so we are limiting appointments, increasing the length of appointments so we can disinfect and sanitize areas more. You come right from your car after you've checked in and temperature check and screenings right to the treatment room. You have your treatment room, you have your treatment in the treatment room, and then you go right back to your car, and that's disinfected and sanitized thoroughly in between.
Kind of taking a closer look at behind the scenes. Seth, you want to come this way? I want to show them the disinfectant room, a couple of things they've purchased, including a sanitation station for your cell phone.
Yeah, so dentists and oral surgeons have always been at the forefront of sterilization, universal precautions. Yeah. Basically, every patient can potentially have an infection, so we have our standard autoclaves that are steam. But, for our electronics, we want to make sure we're having patients possibly check in with iPads. We don't want that transferring on objects. So we can now, with our UV sterilizer, place electronics and anything that can't be sterilized in a classic steam sterilizer in the UV sterilizer.
And don't let the PPE fool you. This is all for your own safety, West Michigan. We've got face shields, N95 masks, which will also have PPE on top of that. And then you'll disregard these every single time, yeah, and then re-sterilize these in your newest purchase over here.
You got it.
Seth, come on over here. I want to show them one last look here inside of a normal room of where they've performed surgeries here for over the years. What's new though?
So every operatory has our high efficiency HEPA grade air filtration. So as a patient leaves, the whole room is disinfected and sanitized. And then on top of that, the door is closed, and for 15 minutes at least, the air is circulated through the high efficiency sterilizer. Nobody's allowed in or out during that time. So we're making sure that the air and the aerosols are cleaned out, as well the entire surfaces are disinfected in the room.
Awesome. Dr. Mark Jessen, thank you very much for your time. Coming up next hour, we're going to be speaking to Dr. A.J. Lytle. Everything is for your protection. It's a perfect opportunity to actually get on the list because of the backlog. They're already 2 weeks out. So get online right now, Advanced Oral Surgery. Give them a call, get on the list, and we'll see you here. For now, Brody Carter in Grand Rapids, Fox 17 News.